Balint syndrome. What is Balint syndrome? Balint syndrome is an uncommon, rare, and incompletely understood triad of severe neuropsychological impairments. It was named in 1909 for the Austro-Hungarian neurologist and psychiatrist Reza Balint who first identified it. If you have Balint syndrome, you only see parts of the whole. For example, when shown a picture of a house, you would only see a window, a door, a wall, and so on, but not the entire house. You'll need to depend on your other senses to guide you. You may need to put toothpaste in your mouth rather than on the toothbrush. You may not be able to use utensils at the table since you can't use your vision to in your hand to pick up a fork or a spoon. In addition, it may be impossible to read, since simultagnosia means you may only see one letter at a time and may not be able to put that letter into the context of a word or sentence. Symptoms and manifestation. Oculomotor apraxia, the inability to intentionally move your eyes towards an object. Optic ataxia, the inability to accurately reach for something you're looking at. Visual simultagnosia, an inability to see the whole picture.
What causes Balint syndrome? Balint syndrome commonly results from ischemic infarctions in bilateral parietal and occipital areas, which means a restriction or inadequate blood supply or dead tissue or necrosis occurs in the affected area, which is the bilateral parietal and occipital areas. Dorsal and ventral stream are the pathways that are damaged in Balint syndrome. Since ischemic infarctions in bilateral parietal and occipital areas is the cause of Balint syndrome, sudden coming of symptoms are due to stroke. There are also reports of Balint syndrome with other neurological disorders such as trauma, loose cardiac arrest, near drowning, metastasis, eclampsia, human immunodeficiency virus, encephalitis, posterior reversible encephalopathy, posterior cortical atrophy, Creutzfeldt-Jakob disease. Even neurodegenerative disease such as Alzheimer's disease can also lead to Balint syndrome. Effects on perception. Since its effect is the triad, which is optic ataxia, ocular apraxia, and simultagnosia, how is it affected? The superior parietal lobule has been shown to be the main center for visual control of movements. SPL is located at the parieto-occipital junction. Neurons in the SPL coordinate visual and hand movement required to reach an object based on visual stimulus. Thus, damage to SPL has been postulated to be the reason for optic ataxia. Simultagnosia refers to the inability to perceive more than one object at a time. Two types of simultagnosia have been described. In the dorsal type, the patient cannot see more than one object at a time and often collides with other objects while walking. This is seen in bilateral parietal lesions. In the ventral type, the patient sees multiple objects at the same time but cannot visually integrate them together. Therefore, they do not collide against objects while walking. The ventral type is in the left inferior occipital temporal lobe lesions. Though the patient had bilateral parietal infarcts, he could walk without bumping into obstacles.